Hello, everyone, and welcome back to Psychedelic Vantage. I hope you're having a great day. Today, Steve and I will be covering the recent news regarding Abbvie and Gilgamesh Pharmaceuticals announcing collaboration and option to license agreement to develop next generation therapies for psychiatric disorders. This is a very significant development in the psychedelic drug development space, of course. But Steve and I will make note that this is for Gilgamesh's non-hallucinogenic neuroplastogens, and Abbvie has put a lot of emphasis on the fact that they are interested in drugs that skip the trip. Nevertheless, it's huge news, and Gilgamesh is also working with with hallucinogenic compounds as well, and we will also be covering the other string of announcements that they have come out with this year. It's been a very, very significant year for Gilgamesh Pharmaceuticals. And without further ado, we're going to get it started. So basically the high level overview of the terms of the deals. Under the terms of the agreement, Abbvie and Gilgamesh have agreed to research and develop a portfolio of next generation therapeutics for psychiatric disorders. They don't specify exactly which program or programs, but they talk about neuroplastogens. So, I assume that just covers their non-hallucinogenic 5-HT2A agonist program, which they now have changed on their website to neuroplastogens. Perhaps maybe other receptors are being targeted, or they narrowed it down on something else in the preclinical phases of development. But upon exercise of the option, Abbvie will lead development and commercialization activities. Gilgamesh will receive an upfront payment of $65 million from Abbvie and is eligible to receive up to $1.95 billion in aggregate option fees and milestones, as well as tiered royalties from mid-single to low digits on net sales. So, Steve, this isn't the first time necessarily that large pharma has got involved in the space. We know Otsuka Pharmaceuticals invested in Compass Pathways Series B. They had the partnership with Perception Neuroscience from Atai. They bought out Mindset Pharma, of course. But the thing is, they are large pharma with a $20 billion market cap. But now the big boys have come to play. Abbvie is top 5, I believe, largest pharmaceutical company in the world with a $285 billion market cap. And to see them getting involved is pretty exciting. I'm curious to hear your take on this news and maybe what it means for Gilgamesh or also the sector as a whole.
Absolutely. 2 billion is definitely not money to scoff at. That is, that's 10 times what most of these companies in the sector are just holding in cash right now. So
that's right.
That can cover multiple entire development of drugs at this point, from
definitely
start to finish, phase 1, phase 2, phase 3, like the whole 9, that can cover a couple drugs. So that is huge. Yeah. That is huge. They're only focusing on the non-psychedelic ones. So that Gilgamesh has money from other areas as well, non-dilutive money that they can focus on the psychedelic drugs. And now they have this 2 billion, which is huge again, that they can put towards their, non-psychedelic compounds, which is awesome.
Yeah, it's ginormous. I agree. And for those who don't know, Steve was also referring to the $14 million NIDA grant to Gilgamesh for their safer ibogaine analog, GM3009, that will cover preclinical and phase 1 development and lead them into a phase 2 efficacy study. So this news is, I think, very obviously I've said it, it's very exciting for the space. Viewers should keep in mind, also amongst the public companies, you have Atai working on non-hallucinogenic. I believe they are earlier stage though. Cybin, I think, is working on these phenethylamine class that is low dose, so there won't be a trip there as from what I know, and it is for neurological conditions, maybe Alzheimer's. Now, it's so, Steve, everyone's wondering, are these drugs even going to work? The non-hallucinogenic. My take is, first of all, I think at this point, maybe 20 plus companies working on this. My take is it's going to be able to work. So with NMDA antagonists for ketamine, they've been able to do this without the dissociative experience and have antidepressant effects. So I guess why not 5-HT2A receptor? Why can't they do it for that? Or 5-HT1A also. I know with non-hallucinogenic derivatives of 5-MeO-DMT. Now, my question is, if it does work, how well will it work? What will it work for? Will it only work for frontline major depressive disorder? Or could it even work for treatment-resistant depression? And I guess time will tell. So, yeah, Steve, what do you think?
I think that's what a lot of these companies are hoping for. You know, they're trying to get it approved for one indication, and then they're going to try it with other things, which once a drug is approved, I would assume it is much easier to, you know, try and target other indications. So if you've seen other drugs, for instance, even if you go on Abbvie's website, you can go on their website and look at their pipeline. Some of their drugs are approved for 10, 12, 15 applications, you know what I mean? And
yep.
I'm sure they didn't start that way. They started out being targeted for one thing, and then, you know, these people take it and they're like, oh, this also works for this and this. And so we could see that these non-hallucinogenic ones start working for, you know, things that we wouldn't even think they target. So
that's a fantastic point. And, you know, another thing, so SSRIs right now, SNRIs, they treat a variety of mental health disorders, ranging from depression, anxiety, OCD, even PTSD. It works for some people as well. The issue, though, is that those drugs can take 4 to 8 weeks to start working. These neuroplastogens hold the promise of working very quickly, at least based on preclinical models. But, you know, what's so cool about Gilgamesh is that they're exploring both sides of the, you know, non-hallucinogenic and also hallucinogenic. And, you know, with that said, we will now look at their overall pipeline. All right, everyone. So here is the pipeline. It's become, you know, last time I checked this, actually, I'm lying. I check it quite often, but if you were to have only checked this last year, you would have seen that everything was preclinical. Now they're moving their, you know, GM 1020, their oral NMDAR antagonist. They just started a phase 2 trial. Also another drug where they are hoping they could get rid of or at least lessen the dissociative effects associated with, I guess, classical NMDA antagonists like ketamine. So it'll be interesting to see if there's an efficacy signal there at the end of the year. I'm very excited about their short-acting hallucinogenic program, GM2505. It is 5-fluoro-MET. As with all their programs, it's a new chemical entity. What they saw in phase 1 is that the drug lasted around 60 to 90 minutes. And the thing that's most fascinating to me is that the team at Gilgamesh have stated that this program can also be similar to, you know, DMT psilocybin, but also have entactogenic features. So like MDMA, a sense of maybe openness, self-love, stuff like that. Which is really interesting because I know people take, you know, in the wild, sort of say MDMA mixed with psilocybin to potentially make it easier to navigate challenging psychedelic experiences. So I think it's not an accident that they were interested in those features of the experience as well. Then you have the oral neuroplastogen, GM5022. I believe that this is definitely what Abbvie is interested in developing with Gilgamesh, although they did not specify which drugs. They said neuroplastogens and other programs. Maybe that includes the GM 1020, but I'm not positive. Then you have the safer Ibogaine analog GM 3009 with the NIDA grant. So, the pipeline's maturing, and I find it hard to not say that that this is one of the leading companies in the space right now. I think it's hard to say that they aren't. And I would also clinical trial execution, incredible execution from this team. And it's really impressive to see what they've accomplished. People, angel investors I've spoken with said that they have been excited about Gilgamesh for quite some time, especially with their team. And later on, when we go through their team, you'll see when they're under their experience, Pfizer, just, this isn't one of those companies where, not to knock on some other companies, I won't mention names. It's not a company where, you had someone who hit it big in cannabis with no experience in drug development come over to the psychedelic medicine space. No, these are seasoned big pharma veterans. And this is really a company to look out for in the private sector, and people should be paying attention. Steve, which programs are you interested in right now and following?
It's actually a great point that you brought up. I think retail is wishing they get their hands on this company at the moment. It's private. A lot of people wish they could invest in this company because they're doing so well for a private company. I'm excited about all of these, honestly, but the at-home use, I like how GM 1020, potential at-home use. I've said this before. I don't know if I've said it on video, but I personally do not think that the long-acting in-clinic psychedelics are going to be, super, super effective. I, for one, would not want to go sit in a clinical setting with a therapist for 6 to 8 hours plus, 2 hours come down and all that.
Yeah.
I really think the 60 to 90-minute duration, even, non-hallucinogenic, if they can have the same effects, like you said, the GM 2505, candy flipping, if you will. That's what they call it in the field. If they can, these new chemical entities, if they can get, the effects of multiple of these drugs without having to take multiple of these drugs and have the side effects of multiple of these drugs, I think that is going to be huge in the space.
Yeah, I think it will be huge as well. And, I think that even if non-hallucinogenic works, again, if they work, how well will they work, first of all, and what will they work for? But let's say they worked for everything that the hallucinogenic drugs are showing promise in right now. I still think there's going to be room for both. And, mental health disorders are not a one-size-fits-all approach for treatment, clearly. And that's also why it's exciting to see all of these companies, not just in the psychedelic medicine space, but in the neuropsychiatry space in general, really start to get things going. Big Pharma had abandoned psychiatry for quite some time because the likelihood of success for these drugs are so low in psychiatry. But with all the prior evidence with psychedelics, it seems like they may start taking interest in the space, including hallucinogenic. Mindset Pharma, their programs that were backed originally by Otsuka were only their hallucinogenic programs. So, and it's going to be a while before the non-hallucinogenic even comes out. But with that said, it's just really exciting all around, not just from an investment perspective, but just people potentially having new treatment options, especially people who just don't respond to frontline, second line treatment. This is going to be hopefully huge.
I agree, and I think anything Ibogaine is going to be fantastic. If anything with Ibogaine that is successful for addiction, opioid use, alcohol use, whatever the indication may be, is going to be huge because a lot of struggle is there with Ibogaine with the heart safe, and I think that's what they're trying to overcome here with the improved cardiac safety profile. So
yeah, and that would be huge. Now I am also hoping Atai can get their Ibogaine program through the clinic. We need new treatment options for opioid use disorder as soon as possible.
Yesterday, yeah.
Like yesterday, the standard of care, I don't want to crap on the standard of care for all these different disorders, but with addiction especially, the success rates are really bad when you look into the statistics. And I'm hoping that these programs can move forward. So let's just briefly look at the team. So as we were speaking about before, Gilgamesh has a very impressive team. Quickly, I'll just go over the fact that Jonathan Sporn had the first exit in the psychedelic medicine space, which was Perception Neuroscience, which he sold. They sold around half the company to Atai Life Sciences. That program ended up not, proving sufficient efficacy in their clinical trials, but nevertheless, the experience that he has being able to exit a company, and also his experience in drug development, Pfizer, J&J, assistant professor of psychiatry at Columbia University, really impressive. Andrew Krugel, I've heard this guy in one interview speaking about Ibogaine. He also sold cures to Atai Life Sciences, around 50% of the company. He's been working on non-hallucinogenic derivatives of Ibogaine, I believe, for a decade plus at the lab at Columbia University. He's absolutely brilliant, as with all the members of the leadership teams, mostly in the psychedelic medicine space, but he seems very laser focused, and I loved his demeanor hearing him in an interview with, I believe it was Bloomberg. It was great. So, then you look at the rest of the team, Pfizer. It's just, this is exactly who you want leading a drug development company.
You have to wonder too, like how much do these connections help get this money to come in? Get this money, like, yep. Because you see, there was some Abbvie's, prior Abbvie employees on the leadership team as well.
Oh, really? I actually didn't notice that.
Yes, right there, Gerard Merrick.
Good. Yeah, good point. I actually didn't know.
I really think it's interesting. I wonder. I'm positive that networking plays at least somewhat of a role, even whether it's small or not, in who gets some of this funding. So
no, it plays, obviously, I think, a huge role. For example, Atai Life Sciences, when they were raising in the early days, the fact that they were able to get on big name investors like Peter Thiel through their connections, I would assume that played a huge role in other people piling money, following Peter Thiel and the smart money. So I think you make a very good point. Not only the team's capability in developing drugs, but also due to their past experience, their networking capabilities. It's a very good point, Steve. Listen, this is a really huge year. I keep on saying it, but I don't know, Steve, I don't know about you. I've been waiting for developments like this in the space for
years, years, and 2020, 2021. I've been doing, in psychedelics for a while now. Yep. And it's just like, there was a point in time where it was like, is this done? Is this ever going to take off? Is anything else going to happen? And, yep. You just got to be patient, is what I've learned in this space. So,
yeah. And I guess as an investor, my take personally is that, it's not even unique. This isn't a unique take here, but there's going to be companies that go to zero. We've already seen that. We've seen plenty of them go to zero. But I think if we're able to pick out the winners, it's going to be a huge investment opportunity. And along with that, I guess something I'll just speak on a little bit. I know we're talking about a private company here, but also in the public markets, I've shared, I have a lot of my personal money in companies like Atai and Cybin. I do have a long-term mindset when it comes to these investments. However, something I always grapple with is, if we see and it's possible, 5x gains within the next year or two. Would that be a good time to, maybe take some money off the table, and allocate a portion of your shares that you will not touch for like 10 years? I think it all comes down to risk tolerance. But one thing I know for sure, when I was holding MindMed back in the day, seeing MindMed, my investment go up significantly, then crashing and not taking any profits was certainly a huge lesson for me. Especially, I only started investing because of psychedelics, actually, and in like early 2021. So, yeah, that's something to think about. Steve, any closing thoughts here?
You just got to be careful where you're putting your money. You know what I mean? You never know in this space what's going to happen. You never know, like, from one trial to the next when a drug's going to be doing great, and the next trial it's going to be, oh, this is not doing well at all, like we thought.
That's
And
right.
yeah, some of these drugs, or some of these companies are focusing on like one drug, two drugs, and they say don't put all your eggs in one basket. That doesn't necessarily save you from a bad investment, because there's so many companies in this space that have a ton of drugs and none of them work out. And it's virtue of investing in biotech companies is you have to be willing to lose all of your money,
That's
or
right.
of course stop losses and such. But if for those of you who buy and don't look at it again, you have to be willing to take those losses. So, but I think you make a great
Sometimes, yeah.
point. Things change and your mindset can change, and I think that's the best way to go with investing.
Yeah, definitely. And in terms of, I agree, diversification can be very important, but sometimes I also think when you have a team that's focused on one or two compounds, it could accelerate clinical development and the team can just focus on a few things. We saw MindMed start out with a ginormous pipeline, narrowed it down to two programs now, and they've executed pretty well. I don't hold MindMed, but I applaud their execution the past year. So with that being said, I hope everyone enjoyed this, coverage of Gilgamesh. I would also, just advise, people to look at some of the private companies in the space right now, and see what they're doing, learn a little bit, look through their investor decks, look up interviews of their CEOs, CSOs. Not only can you learn a lot, it's also really fascinating. I think the thing I love about this channel, our channel, Steve, is that our viewers, I think, I know, are just as passionate as we are about this space. So listen, everyone, I hope you have a great day. If you enjoyed the video, please like and subscribe, share it. And with that being said, have a wonderful day.
Thank you all.